Is the treatment for both stress or urge incontinence, is one easier, or it depends on the patient? Everybody's different.
It depends on the patient. Everybody is different. There are similar treatments for both that are fairly conservative that you can sort of apply to anybody, no matter what kind of incontinence there is.
So let's go back to stress incontinence. That's when somebody's laughing, coughing. How do we approach that? What do you hear on the history? How do you, in your mind, say, oh, this is very common, stress incontinence, I know what I'm going to do? Well, guide me.
So the classic history that a patient will complain, or the chief complaint, would be, I leak when I go run, or I leak when I'm jumping on the trampoline with my kids, or every time I cough or sneeze, I leak. And then there is the absence of needing to go to the bathroom too often or urgently. And so they don't have that. That would be pure stress urinary incontinence.
Is that easy to treat or hard to treat?
Sure, well, there's lots of treatment options, but yes, there are definitely good treatment options. And there's the run the gamut of Kegel exercises, weight loss, and then all the way to surgery.
Do all those help? Certain kind of exercises, losing weight, does that help?
Yes, in fact, that's a great example of a little bit goes a long way. So there's a statistic that if you lose 10% of your body weight, that translates to 50% reduction in incontinent episodes.
Whoa, so that's really, really important to say, we got to talk about your weight, because if you want this to get better, part of the treatment is going to be losing weight.
Correct.